I Hate Politics is a podcast about a human activity we love to hate. I am Sunil Dasgupta. Recently, there have been many reports of MCPS students overdosing on fentanyl, the synthetic opioid drug that has been coursing through the country for several years. The problem is now at the doorstep. In January, MCPS organized a fentanyl awareness workshop at Clarksburg High School. And county leaders, including County Executive Mark Elrich, MCPS Superintendent Monifa McKnight, Montgomery County Police Chief Marcus Jones, and State's Attorney John McCarthy together called for emergency steps to deal with the crisis. The police released data that in 2022 there were 48 overdoses among people under 21 years, 11 of whom died. In 2021, the prior year, there were 27 overdoses and 5 fatalities. I spoke with Dr. Patricia Kapunin, the MCPS medical officer, a newly created post following the criticism the school district received during the pandemic, and to Laura Mitchell, a grandparent in the school system, PTA leader, and chair of the county's Alcohol and Drug Abuse Advisory Council, to try to understand the scope of the problem and what MCPS was doing to bring it under control. Worth pointing out that MCPS has not had a fentanyl-related death in a school building or sent a student to hospital who subsequently died. MCPS has used naloxone, the anti-overdose medication, also known as Narcan, 11 times in this school year. 4 of them prior to the Thanksgiving break and 7 since then. So the rate of Narcan use has almost doubled.
I've never lived a single day in a world without mass school shootings. With Columbine in 99, you'd think by now I'd be desensitized. Sandy Hook when I was in 7th grade. How naive was I to believe things would change? They never change. 'Cause that's the America we live in. That's the America we grew up in, don't you know? That's the America we fight for even.
I Hate Politics is a podcast about our neighborhoods, workplaces, schools and streets, and our local governments as they function in diverse and democratic societies. This means our politics are messy, dirty, sometimes corrupt, with often self-serving politicians. But no matter how much we hate politics, we are never exempt from it, even when we refuse to participate. In fact, the purpose of politics is to keep society moving precisely when we don't agree with each other, like now. Music for this episode comes from Rockville singer-songwriter Gabriel Zvi. Gabriel graduated from MCPS in 2018 and now serves as a commissioner on Rockville City Human Rights Commission and the Montgomery County Committee Against Hate Violence.
That's the America we fight for, even though they fight back at us as they champ life, bringing their guns to a playground fight. And my friends, they never hear the end of it, and I fear we'll never put an end to this. How many lives of children will be lost to it? How many times? How many times?
Every 2 years, Montgomery County and other Maryland counties submit a transportation priorities letter to the Maryland Department of Transportation in the hope that their chosen projects will find support in the statewide capital improvement plan. This process is currently underway for 2023. The process of putting together the draft letter in Montgomery requires reconciliation of 3 sets of recommendations from the county council staff, which reflects the priorities of the County Council, particularly its Transportation and Environment Committee members. Second, the Planning Board, which is usually based in the various existing planning documents, and the County Executive, whose recommendations include those of the County Department of Transportation. Generally, projects go through 3 stages: planning and need study. Second, design and approval, including environmental clearance. And finally, construction. For 2023, Montgomery County has been working on a letter that continues the requests from past priority letters, making small adjustments to the relative ranking of certain projects. The reconciliation process this year has wrestled a little bit over whether road safety or bus rapid transport should lead the letter. The county executive wanted the bus rapid transport request to lead. The county council wanted road safety. Bus rapid transport, or BRT as it is known, is really the centerpiece of this year's letter. All 3 recommending parties have agreed with the ranked priorities with respect to the BRT lines. The first line, connecting Montgomery College's Rockville campus and the college's Germantown campus. Second, on Weers Mill Road from Wheaton to Rockville. And third, to build a new median busway on Route 29 where a BRT line already runs. There are several other projects, but those are in long-term planning stages. The BRT plans became wrapped into the more controversial project to expand I-495 and I-270, the interstates that former Governor Larry Hogan had pushed. Faced with opposition against the plan, Hogan offered Montgomery County financial support for its BRT lines in return for the county's support for his highway expansion plan. The previous county council accepted. The county executive has remained a steadfast opponent. But now, with the new county council in place, the letter seems to suggest some pullback from the previous council's agreement in this regard. It is also true that Hogan did not follow up that agreement with actual project support, and there has been some buyer's remorse on the part of the county council. There is some debate over how soon the American Legion Bridge will have to be replaced, and that debate is going to influence decisions. Wes Moore, the new state governor, has said that he will make his own decisions. The new Maryland Transportation Secretary is former Metro General Manager Paul Wiedenfield. The new Lieutenant Governor, Aruna Miller, is herself a transportation expert. The Moore-Miller administration has not issued clear direction on Montgomery County highway expansion plans. With a Democratic administration in place, however, there is a great deal of hope that transit projects, including BRT, will move forward and highway expansion plans will die. Some of these hopes appear to be misguided. Vision Zero is the county's road safety program aimed particularly at saving the lives of pedestrians and bicyclists. The county executive wanted bus rapid transport to lead the priorities letter. The county council's Transportation and Environment Committee wanted Vision Zero. Irrespective of its placement, the text of the letter on this issue illustrates the trouble the county has had improving road safety. Vision Zero is not a standalone activity. Rather, it is a culture shift to a systematic safety approach. Unlike the BRT request, which comes attached with specific projects, the Vision Zero request is not about projects, but about cultural and organizational change. It is about everything, and as we know, when you make a request about everything, you get little. Road safety as a social problem has suffered from this malaise of lacking specificity. There is not agreement on what key factors produce these deadly outcomes, and abstract asks for cultural change are woefully short on actionable items. The letter also asks the state government to increase off-peak service for the MARC commuter rail that goes through Montgomery and into Frederick and beyond. This is quite possibly the easiest and cheapest item in the letter, but will end up costing more than anyone is willing to pay. The rail freight company, CSX, owns the actual rail tracks, even though they were built in part with public money. And now the state of Maryland has to buy back time slots on the tracks that it helped build in the first place. Virginia, it seems, has worked out with CSX to expand its commuter rail service called the VRE, but I have not been able to find how they made that trade. The Purple Line project is late, but has started construction. Not much to report there. The Montgomery County Council of PTAs, a county-wide body of public school families, passed a resolution recently asking MCPS to pursue digital balance in their curriculum and teaching. After a hard shift toward online education during the pandemic, the parent group is pushing to limit screen-based teaching in favor of actual textbooks and more work done by hand, especially in the elementary grades. The group wants MCPS to track student screen time in an effort to rationalize its use. MCPS says that the curriculum it has previously purchased offers both online and hard copy materials, but often textbooks remain undistributed to students and families. MCPS has a dilemma at its hands. State standardized testing going down now to third grade is administered on computers, and teachers and administrators who are judged on that performance want even the youngest students to practice test taking on computers. Moving the incentive system away from computer-based learning to books, paper, and pencil is not going to be easy. Move over Airbnb. Montgomery County Council member Will Joando is offering a bill which will officially allow county homeowners to rent out their pool, backyard, and home gym should they choose to do so. The sharing economy has been growing since the arrival of Airbnb. There are existing platforms that match homeowners and renters. The bill would regulate this activity by registering rentable facilities and charging a county fee for their rental use. Rockville City expanded its council by 2 from 5 to 7 and is now considering lowering the voting age and permitting non-citizens to vote. You're listening to I Hate Politics. I'm Sunil Dasgupta.
We are people, helping people, not just the leaders of tomorrow. We are the leaders of today, advocating for the changes in this world, well aware of what is right, a message in the words we say. Sometimes we stop and think, why are we doing what we do? Oh, oh. Maybe we just need a new and different point of view. Oh, oh. It's like we don't even see the change, microscopic day by day. Take the chance to turn away and step back and look at the world, you see the difference that you made. So let's lead the way and start a worldwide relay.
Patricia Kapunen, Laura Mitchell, welcome to I Hate Politics.
Hi, thanks for having us.
Thanks so much.
Dr. Kapunen, you are the MCPS medical officer, and MCPS and you personally, I think, have launched a full court press on the issue of fentanyl in Montgomery County in our school system. Can you describe the scope of the problem that you're facing?
Yeah, thank you for your question. One thing that I would say is that we are not launching full court press alone, and this is not something that is new. So MCPS is very excited to get to partner with multiple other county agencies and community organizations under the umbrella of Montgomery Goes Purple, who has been doing this work for some time, since the beginning of the school year, actually. Our school system leaders have stood with county leaders and Montgomery Goes Purple in events to raise awareness. The very first one, right, Laura, was like September 1st, I think. Since probably the late fall, we've really escalated our efforts around data, I think, that indicate that things have continued to get worse this school year. We have known nationally that overdoses and particularly overdoses related to opioids have increased in youth, not just in Montgomery County, but in the entire country from 2019 to 2020. We saw an increase from 2020 to 2021. And when this school year, it became clear that this was not a trend that was stopping, but possibly even accelerating, that's when we really started to accelerate efforts.
When would you identify this acceleration? When did that happen?
Some of it has to do with the quarterly data. When that first set of quarterly data came out around Thanksgiving, that indicated that, the rate seemed to be greater. At that time, there was more coverage in the news of an overdose in a very close neighboring county, and that alerted us to it. We had, at that point, when I came out with my community message, we'd had, I think we were on our fourth administration of Narcan for suspected overdose in a school.
In the last 2 months since Thanksgiving, have things gotten better or worse? What are you seeing?
In Montgomery County, I can't know all the medical events that happen to students in and out of schools. That's not data that comes back to the school, right? Just like if you take your own child to an emergency room, it's not your duty to tell the school what's happened. So I can't speak to the total number of overdoses in Montgomery County students, but I can tell you that we administered Narcan more this year, more in the time since Thanksgiving, since the time then in the first half of those first month and a half of the school year.
So you had 4 Narcan administrations through Thanksgiving, and you've had more than 4 between Thanksgiving and now. So, how many more? Is it 10, 11, 5? Do you know?
So as of today, it's been 11 times.
Between Thanksgiving and now?
No. For the whole school year.
Okay. Laura, you are the chair of the Alcohol and Other Drug Abuse Advisory Council for Montgomery County. What is it you are hearing?
18.4%, according to our statistics, in 2022 of our overdoses were youth. So if you look at the hard numbers, the overdoses that went to the ER were 603. So that'd be about 110 of them being youth. For Narcan administration, it was 572, so that'd be about 105 for the youth. And if you look at the fatalities, it's 104, so that'd be about 19 youth in 2022. So the numbers that we're sharing at these forums are from the police statistics, so they're only the ones that involved fire and EMS. If someone took their child directly to the hospital, we may or may not have captured that information. When they categorize the youth overdose in the stats, youth is 21 and under. So we have to parse out, if you're asking for school age students, right, that we don't know what that number is from 18 to 21, or if they're students, because they can be students up until 21. So the way we capture the data doesn't necessarily directly answer the questions that we're asking.
I do want to just clarify. Now, of these deaths, you have not had a death in any school building or resulting from any overdose, overdose student going from school to the hospital and dying there. There has not been a case like that, right?
I have no knowledge of that. They just had one in Virginia, but this week, but we have not. I'm not aware of that situation.
No. Every time we've administered Narcan in a suspected overdose case, there has not been an overdose-related fatality.
Right. And the fatalities that I know of have all happened in the community.
When you say community, what do you mean? Home?
At home, at a store, at a restaurant, with friends, hanging out at someone else's home, not in school.
Are we in a crisis with this situation right now?
Well, my answer is clearly yes. I first became aware of any of this with my youngest son. That was, I guess, 2000, 2001. And we were devastated that we were losing, 95 people a day to overdose nationally. Now it's over 300, closer to 400.
So there's been a lot of studies. You'll hear conflicting reports about it because overall trends in youth substance use during the COVID pandemic went down. So it's been one of those things that over this whole background of youth substance use and what the trends are and how there have been significant change in those trends in the past 2.5, 3 years, the incidents we've seen of rising opioid incidents and fatalities in young people have increased.
With the other thing that I found as I was preparing for this interview is that overdose incidents and overdose deaths in adults is down.
Mm-hmm. From what number?
It's the Montgomery County Police data.
But remember, that's only the data where they were involved. Here's the thing. The more we talk about and deliver training and supplies of Narcan, the less we're going to have those numbers. Those numbers will look like they're coming down because the police aren't involved. They're getting Narcan from a friend or from a family member if they overdose, and the police aren't called. So they're not captured in those numbers. So if you look at the Overdose Intervention Task Force, the state data, CDC, SAMHSA, you'll see those numbers are way, way up for 2020, 2021, and they started to come down a little bit.
So is it your contention, is it your view that in Montgomery County, we have sufficient Narcan distribution within our community such that the data that police are collecting on adult overdose is under an underestimation?
Oh, I think the data they're collecting on every overdose, adult or student, is underestimated.
As the chair of the advisory council, do you know how widely available Narcan is in Montgomery County?
I do not have that number with me. I didn't think to look that one up, and I apologize for that. But it is significant. We've been having the prevention and harm reduction team from HHS at almost all of our events, at our schools, in our community. We invite the Coke trailer, and we invite the harm reduction team.
What is the level at the distribution of Narcan within MCPS itself?
So since the 2018-2019 school year, we've had Narcan in every single school, including elementary schools. So that's something that's been available. The healthcare, health center, health room staff are trained, as well as a small group of administrators are identified to also be trained to administer it.
In your letter, I think you mentioned that teachers were going to get Narcan as well. Is that correct?
So one thing that we're looking at now is how to expand, where to expand it, making sure we're thoughtful about things like placement and, all the activities that youth find themselves engaged in school, and making sure that they're protected in a variety of spaces. So that might not just be, certain teachers who maybe lead certain activities, but, maybe coaches, athletic trainers. So, different spaces. Can I go back to a question that you guys were just talking about in terms of, the discrepancy between adult overdose deaths and the trend versus youth, as illicit fentanyl was packaged in new ways, as it became available on social media? I think a lot of or some of what has driven the trends in increased deaths and incidents in youth has had to do with not just the appearance of illicit fentanyl on the market, which certainly contributed to overdose deaths in older people, but becoming increasingly available to young people for a variety of reasons over the past couple of years.
Have you been tracking the ecosystem? I mean, what is the basis of your argument?
Well, where we hear that from is from the police. They report that when they have an overdose or when they have a death during that investigation, they're looking at their phones and they're looking at the texts. And so that's how they know the lingo that they're using. That's how they know the apps they're using. You can go on Snapchat or just about any social media.
Is your understanding that that is the primary methodology of delivery of fentanyl-laced opioids to the youth?
I think, I don't know about primary, but it has certainly increased. It changed when we were in lockdown, right? Everybody was online all the time for everything. And so there was a lot of exploration and change and a lot of angst and looking for something to help.
But the pandemic time, overdoses went down.
There are studies and lots of information from DEA, FBI, SAMHSA, all CDC, where they have documented these things.
Where is the actual empirical evidence that we are not exempt from the national trends? And I'll say this because obviously we've had this problem for 20 years, as you described, and we were not part of that trend earlier.
Yeah, we were. We just weren't talking about it.
Is the increase that you are now seeing a reporting artifact, or is it a real increase?
No, the real increase.
But based on what you just said, it seemed like you were suggesting that there's a reporting artifact here.
No, I'm saying that people are more aware of it and we're talking about it more. So it seems bigger, but we've had steady increases for years, for a couple of decades now, just like everybody else in the country. But we weren't talking about it. So nobody's really aware of it. So now when you look at it and all of a sudden you see 100 students overdosed in a year, based on those calculations that I gave you earlier, that's like, where did that come from? I never heard of this. And suddenly it's 100 students. It's not suddenly it's 100 students. We've built up to that. But today it's 100 students.
For me, mortality statistics, medical literature that supports a sharper increase in the past 2.5, 3 years, plus our local statistics that show increases in hospitalization, ER visits, hospitalizations, police attended events, and number of Narcan administration in schools. Like if all those things are going up, I'm worried.
Maryland is erecting right now, the legislature is in the process of erecting a recreational marijuana use infrastructure. How concerned are you about that?
I am worried. I'm worried. I'm a pediatrician. I can't tell you that I'm not worried. Cannabis use has significant, unique consequences on the developing brain, and it's not benign. And even though youth will not be able to legally use if they're under 21, increased accessibility and is going to be a fact. So we are not the first state to do this. And if you look at the experience of other states, it's not clear and obvious what the downstream impact on youth are. It's complicated, but there are many lessons that we can learn from other states in terms of who do we need to protect, who is more at risk from having problems after legalization, we can use this energy and impetus to expand public health resources, including education, treatment, and recovery support for all substance use. I think risk perception modification is an important public health strategy, but it has to be part of a larger strategy. And how we respond to a crisis is exactly what you said, full court press. Let's do all of those things all at once right now.
Mm-hmm.
Right. And so let's talk about some of those things that you are doing. So I believe that you have a phone number that school community members can call to get Narcan. Is that correct?
There is a number for harm reduction services, which is a county level service that provides free training and materials for administering Narcan, including free Narcan. So that is sponsored by our county. They are not by any means the only organization or source of naloxone Narcan available to the community.
So your expectation and hope is that Teachers, staff, students, families, whoever is interested will reach out to the county and reach out at your special events to be able to have access to Narcan.
We want everybody to have the information. And like for a particular family member, we want them to know about it. And then they can decide, is this something that I should stock in my home? Is this something that I need to talk to my kids about and learn more about? I think every person should have the information. It's not just about picking up a dose of Narcan. We really want to make sure that people understand how to use it, how to recognize an overdose, that an overdose is a medical emergency. They alert 911 and they support in absolutely the appropriate way. So it's not just a matter of distributing Narcan. It's a matter of being able to engage people and using it properly and making sure they have access to all of the resources.
If we are expecting society to do things, then what is the role of the school in, for example, specifically with respect to prevention and availability?
The first thing is education. We have our formal curriculum and all the other opportunities we have to educate children outside of our formal curriculum. Outside of a formal curriculum and educating children, we have all the opportunities in which we formally and informally engage with parents to help them support the education of children. So education is like our number one thing. It's our jam. That's how we approach problems. That's how we often measure problems or measure success. And then the second thing is, public safety measures. So just like in the wider community, we work with law enforcement. We work with, security and safety to think about how do we keep schools safe? That's something that is a very active conversation within the district right now and has to happen not just on a district level, but an individually community level. And I'll move on to more important things. 3 is health services and supports in schools, right? So we have school health rooms, school nurses who are part of not just, and then, psychologists, counselors, like a whole arsenal of people who are providing support services for students who are important, not just in the emergency response to a suspected overdose, but for caring for kids every single day, showing them that care and support, monitoring their health and mental health, and being first line responders.
It is my understanding that we were short of school nurses, that not all our schools had nurses. We have a shortage of school psychologists. There's a huge shortage also of teachers and all kinds of things. So when you're wanting to do more of all of this and you have these significant shortages at hand, how are you meeting those shortages to be able to do what you want to do?
I am confident in my Health and Human Services partners to provide, run and staff our health rooms in our schools.
What is the shortage?
I can't give you details on the exact shortage. Again, our school health rooms are run by school health services at the Department of Health and Human Services. So that's not a personnel issue I'm up to date on. But there is a national shortage of nurses. I think everybody knows that. That's been widely touted in the news.
In the next 6 months, what are your expectations?
Yeah, I would also like to see a decrease in incidents, fatal and non-fatal, related to opioid related overdoses. I think, for me, you hear me talking a lot about what can parents do, what can students do, youth engagement, parent support, families being able to open up conversations about mental health in general takes us way back to the beginning of prevention.
What would you like to tell parents about how they should talk about this to elementary school students, middle school students, and high school students?
Keep involved. It becomes really hard to keep involved with kids as they become more socially independent, or maybe, they seem more socially reclusive as they're talking to friends on social media, and it's harder to become part of their lives, or you become part of their lives in a different way. Like, don't quit. Keep being part of their lives, understand what they're doing, who their friends are, what they like, who they are becoming, who they want to become, who they don't want to become, and engage them in conversations about all of those things. Be accessible and available and non-judgmental, or be able to engage in a non-judgmental way about important things. And all these things, I think, they're not easy. I mean, I didn't get a parenting handbook, did you?
I'm going to butt in here, because one thing that we don't do, I know from my experience, if you're not comfortable with something, it's harder to talk about, right? So if you don't know all of the ins and outs and what the names that they're using for the drugs that are circulating right now and how they're getting them and all those things, then how do you have that conversation with them? If you don't understand and know about your own mental health or about mental health in general, how do you have that conversation with your child?
So how do you?
Right now, there's a lot of stuff going on, and it's not easy to talk about in the time that we have with our kids. We might choose other things to talk about and not go straight on, run into the bullets of talking about something that's happened in the community that, that you may not have the words to talk about. So talk about the hard things when they happen.
From what you say to me, I take it that you want better parenting.
I wouldn't call it better parenting. Here's another thing. Substance use can be very secretive. It can be hard to come to somebody and ask for help. Oftentimes when kids are struggling with their mental health, they might not know exactly what's going on to the point that they can actually reach out to their parents if they want to. They might think, if they're worried about a friend, that they're betraying their confidentiality when they know something that really needs an adult's attention right now. So all of those things do not make you a bad parent if you don't know something that your child is telling you. But what it means is that perhaps we need to be sometimes more proactive as parents in engaging our kids when we get that feeling that something's wrong, but we're not sure what to do. I'm also hopeful that we can give parents more education and access to resources if they are worried, and they've tried to figure out what's going on, or they have asked for help and it's not the right kind of help, right? That's another thing that parents get into, is that they ask for help. The right help is not there. They're not quite sure what's going on. So part of the education about, this is what substance use does or does not look like, and it can look like anything, or this is what mental health issues, they may not look exactly the same as in the Celexa commercial for adults. So equipping parents with that kind of knowledge will, perhaps give them a higher radar for being able to be proactive and in detecting and responding to problems earlier before they happen.
Laura Mitchell, Patricia Kapunen, thank you for coming on I Hate Politics.
Thank you so much for having us.
Thank you.
They said a world of wonder, she took only steps but left more than just footprints. Oh, 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 oh. Like fireflies in a mason jar, light that would outshine any starlight that shined on me. Oh, and everyone, like succulents on a windowsill, breathe life into the air. She'd fill a room with energy. She said,
You're listening to I Hate Politics. I'm Sunil Dasgupta. What lessons can we draw from my conversation with MCPS Medical Officer Patricia Kapunen and Montgomery County Alcohol and Other Drug Abuse Advisory Council Chair Laura Mitchell? First, I think it is important to note that as bad as the youth fentanyl crisis is in Montgomery County, it is better than surrounding jurisdictions. Conversely, Montgomery County, because of its wealth and ability to buy, has always been a large importer of illicit drugs. The fact that there are not more overdoses is actually the more surprising conclusion. Note as well that there have not been any deaths in school buildings, and no overdose student sent to the emergency room from MCPS has died. As Laura Mitchell says, all deaths of students have been in the community, in homes, on the streets, other public places. This means that schools are something of a safe haven, where an unconscious child is cared for. This is an awesome responsibility for a school to have to bear. Second, since most overdose cases involve illicitly manufactured fentanyl bought off the street or on the internet rather than prescribed by doctors, what we are seeing is not overdosing, but rather fentanyl poisoning. For the last several years, doctors have been prescribing fewer legal opioids, and consequently, the rate of adult overdosing has fallen somewhat. Though, Laura Mitchell does make the good point that we have to ask about the benchmark we are using to measure improvement. Still, it is the case that the fentanyl causing these incidents and deaths are the street kind, and it helps to think of the problem as poisoning, which is unintended, rather than overdosing, which assigns some degree of responsibility to the victim. Third, we really don't know where the fentanyl is coming from. We know it after the fact. We know it in the abstract. But we don't know it in time to intercept small packages in a global mail system that ships millions and millions of packages each day. This leaves local governments and school districts, who generally don't have statutory authority for interception, to want to talk mainly about parent education as the way of stemming the crisis. Talk to your kids, we are told repeatedly, as if we don't already. Stay involved, as Dr. Kapunan says, is the basic definition of parenting. As a 5-year plan for an incoming middle schooler, it is a good one. But how do you talk to a child who doesn't want to talk with you already? And then talk about drug use, which they would rather avoid, I'd imagine. The larger problem here is that the tools of local government are poor instruments for a nationwide problem. Fourth, what local government and school districts can do is largely on the response end. To have school nurses and psychologists in place, to have Narcan widely available and enough folks trained to use it, to set up a referral system to healthcare providers for when the emergency is over. With a national labor shortage at hand, however, this is a hard ask. That's all for this episode. You've been listening to I Hate Politics. I'm Sunil Dasgupta. Music for this episode comes from Rockville singer-songwriter Gabriel Zwi. They graduated from MCPS in 2018 and now serve as a commissioner on Rockville City Human Rights Commission and on the Montgomery County Committee Against Hate Violence. If you want to share your music on the show or know someone else who might want to, please sign up for updates at our website, ihppod.org, or email us at ihppod@gmail.com. I hope you'll subscribe and share the show as we bring you stories about politics close to you and to your home. See you next time.
Oh, they walk this earth right by your side. Oh, it's the same soul, same mind. They are from another galaxy. Run from them, you cannot be their friend. Undeserving of your love, they do not feel as a human does. It's otherworldly stuff, 'cause they are from another galaxy. Oh, they walk this earth right by your side. Oh, it's the same soul, same mind, but they are from another galaxy. mask comes off and you see what's on the inside, what you've been trying to hide. You're the same kind. You're the same kind. Look at you. Step back and look at you. You are the product of stardust, of particles, things I would never change. Their words will fade away out into